Hi, this is Dr. Stephen Evans with Outclick Magazine. Today we're talking with Michael Arguelles, who is the Clinical Informatics Educator at Florida Medical Center here in Fort Lauderdale, Florida. Hi, Michael. Welcome to the program today.
Hi, Stephen. Pleasure to be here.
Hi. Thank you. Thank you for all that you all are doing during all of this COVID movie, drama, whatever we want to call it, that you're doing out there at the hospital for our community. I want to say thank you for that, first of all.
Oh, the thanks is very much appreciated. It is a very tough job, and all of our staff is very thankful for that.
Thank you. I used to work in medical education. I know how tough it is for people working in healthcare, especially given all of the additional challenges that's going on. One of the things that you are most involved with there at Florida Medical Center is the Equality Task Force. If you wouldn't mind to tell us about that and kind of the mission of what that does there at Florida Medical Center.
Sure. So with the Equality Task Force, so with Florida Medical Center being a leader in LGBTQ plus competent care, we formed the Equality Task Force, an organization within our hospital composed of staff members. So it's open to any staff member that has any interest in joining. And we basically meet regularly and we compose events. We address issues within the hospital as it relates to the LGBTQ plus community. So it's basically where we go to voice any concerns that we have in regards to our LGBTQ care. When it comes to proposing ideas for new policies to help improve inclusivity of care for that community, and when it comes to planning events as well. So we really are a catch-all organization when it comes to the LGBTQ plus community within Florida Medical Center and our patients as well.
Okay, so this is a proactive community or proactive group within the hospital to address concerns and to actually do planning to provide better patient care for our LGBTQ community, it sounds like.
Correct. That is 100% accurate description.
And then if there are concerns within the hospital, this is a group that can be an advisory group to make new policies or provide better ways of patient care if issues arise.
Correct. Should an issue arise and it does get brought to our attention, we discuss it as a group and we decide, what needs to be done about this. Do we need to make recommendations on better ways to approach the situation in the future? Is there already a best practice in place somewhere else that we can adopt in the facility? So it does depend on each particular situation, but yes, we do address them on a case-by-case basis proactively.
So do they make decisions? They can advise the decision makers there at the hospital. This sounds like a very forward-thinking kind of group for the hospital to have.
Yes. For example, let me go ahead and use this example that we had in the past. So at one point in the past, we had a patient who was transgender. They were biologically one gender, but identified as opposite gender. So when they came in through our emergency room, the question, where do you bed the patient? So with a semi-private room and where you have patients with two rooms with two patients in one room, you would generally sort them by gender. But what happens with the transgender patient? Do you bed them according to their biological gender, or do you bed them based off of the gender with which they identify? And in this case, the patient was in process of a transition. So we weren't sure what to do at the time, but then we eventually came up with a workflow that when this does come up, we would basically treat the patient as if they had any other situation that necessitated them to be treated differently from the rest of the hospital population, and they would effectively get a separate room. So it follows a logic based off of when you have a patient with special needs, for example, a patient with a weakened immune system that really can't be around other patients. We just followed that same logic and said, we'll just put them in a separate room. So that was one of the adjustments that was kind of born out of our proactive group.
I think that's a great example from what my background calls patient-centered medicine, where the care is adapted to what the individual patient needs for that specific kind of care or that specific case. That's obviously something extremely unique I think that's a great example of what you can do for that kind of patient like that. You stole my question. My question would be, what's one of your proudest accomplishments? And I think that definitely would have to be one for that particular patient.
Yes, that was a particularly big moment for us because in our earlier years, it was one of our most signature moments where we situation, we discussed it, and we made a decision that affected ultimately the way we treat patients going forward. And that's ultimately one of the goals of the Equality Task Force is to shape that kind of healthcare, and that's to being a leader in LGBTQ plus competent care is to take the current environment and mold it in a way that's going to be more inclusive of our LGBTQ plus population.
What's some of words of advice you might have for any healthcare worker who has someone who identifies as LGBTQ that comes into their office?
So when it comes to anyone who is a member of the LGBTQ community, when you have patients, so I'm sorry, was your question regarding if the healthcare provider was LGBTQ or the patients?
If the patient is LGBTQ, what are some words of advice for any healthcare provider, whether it be nurse, PA, physician? What are some words of advice for the provider if they have an LGBTQ patient?
Okay, so my best word of advice is to remember one of the most basic things that you learned in nursing school. Remember that your patient's healthcare experience is unique to your patient. So if you work on a stroke unit and you work with a lot of stroke patients, yes, your going to be similar to each other because you're, for the most part, caring for stroke patients, but everyone experiences that stroke differently. So each patient you have to handle separately. So if you have a patient that comes in and they identify as a member of the LGBTQ plus community, regardless of where you stand on a moral compass, on an ethical compass in regards to the LGBTQ plus community, you as a healthcare provider have to remember that that patient is experiencing what that patient is experiencing. So it can be difficult for some healthcare providers to understand that when it comes to issues like LGBTQ plus competent care, but it's very important to be able to step back and then analyze how you feel about the situation and then ask yourself, is what I'm feeling objectively observed, or is this my own personal feelings that I'm projecting onto my situation with the current patient? Because you always have to understand as a healthcare provider that what you think the patient is experiencing is not necessarily what the patient is experiencing. And you always need to make sure that you're open-minded towards your patient's care.
I think you made several good points. One is listen. 2 is be empathetic. 3 is be objective and provide. And 4 is provide the best treatment of care based on those three factors alone. So, good job. Yeah, it's very good. Tell me about some of the events that the Equality Task Force has put on and sponsored in the past. I think you all have had some great events that have been, again, very proactive for the LGBT community.
Yes, well, when we first came up with a Equality Task Force, so Wilton Manors is not too far off from Florida Medical Center. And one of the first things we did was kind of make ourselves known to the park located in Wilton Manors. So what we did was engaging in a good amount of the events over in Wilton Manors. For example, the Rainbow 5K that the Pride Center hosts on an annual basis. We encourage participation from our hospital. We all will run there on behalf of the Pride Center at Equality Park, and it's our favorite events to participate in because it does get the employees in the hospital out and about in something that's not really healthcare related. Also, the Stonewall Parade that happens in June.
Okay.
In the past, we have set up a booth there to make our presence known out there and to provide outreach as well. Within the hospital, we've had a couple of events going on. During Pride Month every year, we try our best to make sure that we have a guest speaker that can offer continuing education credits, which is something that healthcare professionals need on a regular basis in order to maintain their licensure. And we try to make it so that it's centered around the LGBTQ plus community. We have a few interesting speakers in regards to that. And then in addition to that, we have an awareness campaign during Pride Month where we take over the hospital's computer monitors and display monitors. And we basically air a lot of interesting facts about the LGBTQ plus community, a lot of major milestones, the Supreme Court decision to allow gay marriage on a national basis, the number of gay couples located in local communities, a lot of varying statistics that in general are quite eye-opening if you never knew them before. And then probably my favorite event during Pride Month is the We've Got Pride bake sale, where we basically turn it into a contest, and people in the hospital who are avid bakers bake rainbow-themed baked goods. And in the past has been a contest on who makes the most rainbowy baked good, and then we sell. We have the bake sale, and then we donate it all to an LGBTQ plus organization. I believe last year we donated all of our proceeds to the Trevor Project.
Okay.
For that one.
No, I didn't. I didn't realize that. So you have a bake. That's really interesting. A bake sale, and then and they're themed cakes. Did you say?
Yes, pretty much any baked good is fair game, and
okay.
You can technically bring in any baked good, but in order to we encourage rainbow baked goods. And I remember the last time we turned it into a contest, the winner had made rainbow macaroons with rainbow marine filling, and I was like, that's a bit extra. I really couldn't compete against that personally because I made rainbow cookies, but I can't compete against rainbow macaroons. But yeah, it tends to be a very festive event.
Wow, that we need to do a story and a picture and some photos on that when that comes around again. So please make sure you let us know when that happens again. We need to be out there and have some photos of that. That sounds really amazing.
I'll keep that in mind.
Yeah. Tell me again a little bit more about the screensavers and what you that projects on all the screens and its milestones and helps educate your staff. Is that what you were saying?
Yeah, so ordinarily during any other time of the year, the hospital screensavers have data that automatically profiles through that's relevant to your hospital staff, updates of what's going on in the hospital. During Pride Month, we add a bunch of slides in there that basically say, FMC proud, a heritage of LGBTQ plus freedom and liberty. And then every now and then the screen will change and it will show you a different interesting fact. It'll tell you, on this date and time, the Supreme Court said that gay marriage is legal all around the country. And then the next slide might say, prior to this decision, X amount of states had already decided that, this is going to be a freedom. And the next slide might say, did you know that in Broward County, the number of LGBTQ couples is X amount of lesbian couples and X amount of gay men couples? So we share a lot of statistical information for the staff. And I've had a couple of staff say, I didn't really realize that, or, that's pretty interesting. Of particular note was at the time, before Justin Flippin's unfortunate passing, was when when Wilton Manor's entire basically governing body was members of the LGBTQ plus community, which was second only to Palm Springs, California. And when I would tell people that, they would say, really, we're the second one? Then some of them would say, I thought we'd have more than that. And some of them would say, like, wow, I can't believe that's happening, so close to us.
That's really fascinating project. You and I will talk offline because I want to hear more about that project. Because one, it's not only proactive, two, from a standpoint of putting it together, that takes a lot of time for somebody to sit down and do all that research and actually put the time in to do that. And for the hospital to put that much time into a project like that, I think is really amazing. And to be that proactive in educating people and doing that, that's an amazing program. That's great. That's good to hear. So let's dialogue about that when you get time. Okay. One of the things too we talked about was the workplace culture. You all being more proactive about fostering a workplace culture that mirrors our community culture.
Yes, so that's very true. So with our workplace culture, so when we became leaders in LGBTQ plus competent care, I wasn't sure, how the hospital staff would react to it. So whenever you have a large organization with a lot of people, you never really know how necessarily everyone is going to react. And I was actually a bit surprised. For the most part, a lot of our staff members are, on board with it. They're like, oh, it's about time, or, I'm surprised we didn't do this earlier. And it's a very comforting work culture to be in. And with our community culture around us, with Wilton Manors being so nearby, it's very comforting to know that the LGBTQ plus community enjoys, so much support within the healthcare organization and outside the healthcare organization. So it really is kind of a marriage between the two. It's kind of formed an alliance between your stay within the hospital and your life outside in the community, because you'll find acceptance in both, and it's actually very good to see. And I was pleasantly surprised when I saw how overwhelmingly accepting everyone is of the equality task force and its goals.
That's amazing. That's great to hear. How has COVID affected the task force and the efforts, obviously, there at the hospital, as it's affected so many things?
Well, in regards to the equality task force itself, it's actually had a pretty severe impact. So first of all, you probably know the Rainbow 5K was postponed.
Mm-hmm.
The AIDS Walk was postponed.
Mm-hmm.
And during Pride Month, we couldn't have a guest speaker because social distancing was a concern even in our auditorium. Mm-hmm. So we had to cancel that. And then because, having a bake sale during a pandemic, what we didn't imagine would be very successful, we had to cancel the We've Got Pride bake sale for this year as well. We did end up still continuing on with our awareness campaign that I explained previously with the slides taking over the hospital. And we did actually hand out Pride stickers to the hospital staff that had interest in them. So one of them is love, one of them is a rainbow heart, and we actually got a hold of the ally stickers, which is a black and white heart with a rainbow A on it. So people, members of the LGBTQ plus community that didn't want a rainbow heart could actually have an ally heart. That way they could show people that, I'm not a member of the LGBTQ plus community, but I wholeheartedly support it. And I see people walking around with that sticker on their laptops, and every time I see it, I smile. I'm like, I gave them that sticker, and they're proud to show it off. So we did continue with our awareness campaign, but in terms of a lot of our engagement projects, a lot of those were shelved or postponed, typically due to COVID and a lot of the social distancing concerns.
Yeah, that's affected a lot of people because they relied on so many of the events that they can't have now because of those. Mm-hmm. Yeah, but this is such a great example of instigating social change in a positive way, using education and fun and relationships to really create a positive social change. Mm-hmm. Congratulations. I wanted to show your website. We talked about this earlier in our previous interview, but you all even have it on your website. You have a special LGBT section or special section for LGBT patients on your website. Mm-hmm. So they can go there and read. There's more resources. We talked to Frank earlier, but there are resources there on your website too.
Yep.
Yeah. Very good. Very good. Is there anything you wanted to cover that we didn't cover?
No, I think we pretty much got everything that we had intended to discuss.
Good. Good. My last question I always ask people is, are there any encouraging words can you give someone during these trying times?
So being a healthcare worker working in a hospital, granted I'm not direct patient, but still being in that situation, I really advise everyone that's, if you're stuck at home, if you have a precarious financial situation, no matter where you are right now during this pandemic, I encourage you to sit down and take a look around you and take a look at what you do have. A lot of us take for granted the things we have because it gets lost in our day-to-day lives. But take a look at your friends and your family, even just your pets. Take a moment and acknowledge and be very much grateful for what you do have. A lot of the things that you would generally overlook. When I go home, I live with a roommate, his husband, and their 5 kids. So home, sometimes I'm frustrated because the house is loud, but ever since this whole pandemic started, I would go home and I would say, I'm very thankful that I'm able to go home, to all these people. I'm very thankful that they haven't gotten sick. I have to do everything I can to make sure, everything is safe in the household and that I'm not putting them at risk. But I do recommend that everyone sit back and reflect and acknowledge what you do have and what you do have to be thankful for, because that can make a big difference when all you do is change your perspective from a negative one to a positive one, just to acknowledge what you do have. So that would be my recommendation, is to just be thankful for what you do have, and to sit back and to take a look at your situation differently in a more positive light.
It's what I've been taught to be called an attitude of gratitude, which is can be very challenging during this time. I've talked to a lot of friends who have depression issues, isolation issues. Some have not left the house for months because they are very afraid of it. Some that are leaving just a little bit. Some that are in other states and so isolated. So it is very tough, but I appreciate that word of encouragement. And we have to take a step back and realize this is not the end of the world. It is not the end of things. And we have to be more intentional about looking for things to be thankful for. You're exactly right. You're exactly right.
Exactly correct.
Thank you. Well, thank you for sharing with us. I wanted to share your website real quick before we cut out so people can see your website. They can go to FloridaMedSTR.com.
FloridaMedCTR.com.
That's your website to check out more information. So they can see that as well. And we've got that all up on the screen too. So very good. Thank you so much. It's been a real joy. And we thank you for being proactive on the LGBTQA efforts, both internally and externally, and for providing a new level of patient care.
It is my privilege and my pleasure. And Florida Medical Center is here for all of you.
Very good. We are outclick.com, OUTCLIQUE.com, or you can text OCQ to 22828 for more information and to stay updated with us. Thank you, everyone. Stay safe and have a great night.